Well, thanks, Higgs. In Kisumu, the county government will officially open a 2-day universal health coverage, focusing on the role of primary health care ahead of the national rollout of the UHC program.
So let's now link up with Laura Otieno, who is covering that conference. Laura, good morning. Quick question. What does this mean for the community? What will it do for the community?
Well, Zinzi, the purpose of the conference is to basically discuss parameters which are considered pivotal for the success of the universal health coverage. And one of the main pillar is primary health care. And what that means for the community is that they will have a platform to access health care at the lowest levels possible. Remember, the goal of UHC is to offer some sort of health care, not only affordable, but also to reduce the number of referrals to big hospitals, because for a long time in Kenya, it has been a norm for big hospitals, level 4 hospitals, to be having quite a number of patients to be dealing with, and yet the level 2s and level 3s, despite having the ability to handle certain kinds of diseases, then people have been having the perception that they can only get treatment at level 4 hospitals. So the theme of the conference this year is to basically dissect the role of primary health care to the success of UHC. And Kisumu County is one of the counties that recently ratified a bill that will see the payment, or rather community health workers. Previously they were known as community health volunteers, but they are now referred to as workers, because they will be receiving a stipend from the county government in a move to sort of ensure that every person at the grassroots level has access, or there is a database for their health records in terms of blood pressure, in terms of their blood sugar and things like that, so that it's easier when these people are referred to the next level of hospitals to get healthcare. But then, you know, Zinzi, in as much as they're discussing primary healthcare, the elephant in the room is the ability of counties to actually pay for drugs, because despite the fact that Kisumu, Isiolo, Nyeri and Machakos, which are piloting UHC, they are receiving drugs for free from KEMSA, because the national government has taken care of that fund. But then now the bigger question is, what will be the effect when the national rollout is done? Will the national government have the capacity to be paying out money to KEMSA? Because as it stands, even though Kisumu has had a supply come in through the pilot basis of UHC, they still owe KEMSA a total of 77 million shillings. So once the pilot program is done, those are some of the difficult questions that the county will have to grapple with, because the UHC rollout would have begun, and then they will be dealing with a backdrop of 77 million shillings to KEMSA. And moving forward, of course, people now will be moving to hospitals with their UHC cards, expecting to get drugs as usual. But then maybe they will be blacklisted in the case of some counties which have already been blacklisted by KEMSA, including Nairobi, for huge debts. So of course that is a question that we hope the delegation in the conference will be addressing, because as it stands, about 2,000 delegates have already reported to this place to also address the gaps in UHC and how they can be rectified ahead of the national rollout. So those are some of the questions that we hope to raise in this conference, and see what the recommendation will be in moving forward, especially on matters of drug supply by KEMSA to counties. Zinzi.
Laura, very briefly, what's the impact been like on UHC? Because Kisumu is one of the pilot counties. What are the people saying on the ground? Is there an impact? Do they feel it?
Well, here in Kisumu, Trevor, it has been a success of sorts, need I say, because residents so far are lauding the move, because they can access healthcare by virtue that they have a UHC card, which were distributed sometime 2 months ago. So as long as they have a UHC card, they walk into a facility, get services and walk out. So it is being lauded by residents so far, even though there are hitches here and there, because some of them are saying that the ballooning numbers, because more people are now moving to hospitals, and there are long queues and lack of manpower to be attending to those queues. And also maybe, Trevor, just to add, in the backdrop of the rollout of UHC, perhaps counties now, because health is a devolved function, they need to be looking at upskilling the manpower, because ahead of the national rollout, everybody will now be moving to hospitals away from the current norm where people would dismiss, or rather would self-diagnose and go over the counter to get medicine. So maybe counties also need to really look into upskilling the manpower. For example, in Kisumu County, there are about 300 doctors and 700 nurses, and looking at a projected population of 1.2 million, then perhaps the county government and all other county governments in totality need to look at the upskill of the manpower in hospitals, because UHC benchmarking from the example in Kisumu here has been successful so far, where everybody now moves to hospitals expecting to get services. Trevor.
Thanks, Laura.